Benign prostatic hyperplasia is a condition where the prostate, which is a walnut-sized body part made of glandular and muscular tissues, grows in size. The prostate surrounds part of the urethra, which is the tube that carries urine and sperm out of the body. Benign prostatic hyperplasia, or sometimes hypertrophy, is an enlarged prostate gland, and it's not typically a serious problem, nor on its own is it a life-threatening condition. And to clear up a common misconception, benign prostatic hyperplasia is not cancer, nor does it cause prostate cancer. Benign prostatic hyperplasia is a condition that's associated with older men. Androgenic hormones have been known to play an important role in the development of benign prostatic hyperplasia, and they have been a target in its medical treatment. Estrogens have also been implicated in benign prostatic hyperplasia, but in contrast to androgens, the function of estrogens in the prostate is still obscure. The effects of estrogen in the prostate are mediated by estrogen receptors alpha and beta. These two receptors have different expression and functions in the prostate, thereby presenting a window of opportunity to selectively target them for therapeutic purposes in treating benign prostatic hyperplasia. The action of estrogens, as mediated by estrogen receptors, appears to contribute to the development of benign prostatic hyperplasia in men through an intricate molecular process. Vitamin D. Increasing the intake of vitamin D from the diet and supplements has shown a correlation with decreased benign prostatic hyperplasia prevalence. Vitamin D analogues of up to 6,000 international units per day have been shown to decrease prostate volume in benign prostatic hyperplasia patients. You want to be sure to get a 25-hydroxy vitamin D blood test and then supplement accordingly with vitamin D3 to correct any deficiency that you may have that may be contributing to this condition. Vitamin K2 works synergistically with vitamin D3. It was also labelled Activator X by Dr. Weston Price, who found that it reduced the risk of many diseases and was also linked to extended lifespan. Intervention studies with vitamin K2 brought down levels of markers of benign prostatic hyperplasia, and it also led to the relief of some of the disease endpoints. The process of varicose vein formation includes a role for vitamin K, implicating a lack of vitamin K in the development of varicose, which then leads to benign prostate hyperplasia. You want to take vitamin K2 in its most absorbable form, which is called MK7, and in dose ranges from 100 to 300 micrograms per day. Coenzyme Q10. Benign prostatic hyperplasia can raise the PSA score, which is the prostate-specific antigen level, by 2 to 3 times higher than the normal level. Coenzyme Q10 therapy was shown to significantly reduce the serum PSA level. You want to take coenzyme Q10 in its most absorbable form, which is called ubiquinol, in doses from 200 to 400 milligrams per day. Resveratrol is the anti-aging compound that's found naturally in small amounts in red wine and in the herb Japanese knotweed. Resveratrol is reported to inhibit the growth of the prostate, which is characteristic of benign prostatic hyperplasia. Resveratrol treatment inhibited the growth of BPH1 and it increased apoptosis of the cells. A typical dose of resveratrol is 500 to 1000 milligrams per day, taken in the form of trans resveratrol. Curcumin is found in turmeric roots. Curcumin significantly lowers prostate weight and prostate volume, and curcumin treatment decreased the expression of VGF and TGF-beta1 and IGF-1 among growth factors in the prostate tissue. These findings suggest that curcumin inhibited the development of benign prostatic hyperplasia and might be a useful herb in its treatment. Doses of curcumin can range from anywhere from 1,000 milligrams per day up to 5,000 milligrams per day. However, due to its poor bioavailability, it should be consumed with biopterin, which is a black pepper extract, or it should be taken with an oil like fish oil, butter, ghee, or coconut oil. Vitamin C. Results suggest that vitamin C inhibits testosterone-induced HIF-1 alpha expression, and by doing so, it effectively prevents prostate hyperplasia. You should check out my video on how to make liposomal vitamin C at home. This method can also be used to enhance the bioavailability of some of the other supplements mentioned here, like the curcumin and the resveratrol. Zinc is required by the body for around 100 different processes. More than 16 studies have reported that zinc is markedly decreased, around 60 to 80%, in prostate cancer when compared to normal and benign prostate tissue, and no study has reported prostate cancer without a decreased level of zinc being found. The consequences of only a mild zinc deficiency are an impaired immune system, and especially this is relevant to the maintenance of health, and it may be critical in the prevention of age-related diseases, especially in the prostate. Adequate zinc status will help to maintain health and physiological function, and to prevent prostate disease from developing or from further progressing, thereby acting as a vital anti-benign prostatic hyperplasia agent. Zinc has low bioavailability, and like vitamin C, its absorption can be increased when it's taken with quercetin, which is the bioflavonoid that's found naturally in grapefruit peel or found in elderberry juice. It can also be taken as a supplement in doses ranging from 500 to 1,000 milligrams per day of quercetin. According to results of a study, it seems that quercetin has better effects on reducing benign prostatic hyperplasia symptoms and increasing urine flow rates when it was compared to a placebo. So this would be a beneficial additive to have with your zinc and vitamin C in the treatment. Increasing epidemiologic evidence suggests that diabetes significantly increases the risk of benign prostatic hyperplasia. You want to check out my videos on type 1 and type 2 diabetes for herbal and nutritional information to help to treat these conditions naturally. The role of inflammation in benign prostatic hyperplasia development was highlighted by the strong correlation between histological inflammation, IPSS, and prostate volume. Prostate enlargement due to chronic inflammatory processes may progressively conduce to benign prostatic hyperplasia progression. Therefore, inflammation is a therapeutic target for treating benign prostatic hyperplasia. You want to check out my videos on inflammation and my video on antioxidants for some helpful tips here. Immune cells infiltrate the gland and induce prostate lesions. The genetic background and the hormonal imbalances are factors that can contribute to the onset of the disease in susceptible males. Moreover, spontaneous autoimmune prostatitis could also occur with advanced age in susceptible strains. You should check out my video on treating autoimmune conditions with diet and lifestyle changes for ways that may be helpful here. Oxidative DNA damage is likely to play an important role in prostate hyperplasia, as was depicted by a decreased activity of free radical scavenging enzymes and glutathione levels, and this might have enhanced DNA damage, which can lead to the benign prostatic hyperplasia. You should check out my video on glutathione to learn about its importance in maintaining health. The demand for complementary and alternative therapies, including an interest in the use of phytotherapy, has increased in recent times. This is especially important as some of the medications currently in use for the treatment of benign prostatic hyperplasia have undesirable adverse effects. Phytoestrogens, which are naturally occurring compounds from plants that mimic estrogens, have been known to be used in the treatment and the prevention of benign prostatic hyperplasia. The major classes of phytoestrogens include isoflavones, lignins, and cumescins. Isoflavones are perhaps the most researched class of the phytoestrogens. They are polyphenic compounds which are naturally found conjugated to sugar molecules as biologically inactive glycosides. Upon the breakdown of isoflavone glycoside conjugates, the sugar molecules are released, resulting in biologically active isoflavone aglycones, such as genistein, didzin, and glycine. Isoflavones are most abundant in legumes, like soybeans, as well as being found in grains, nuts, wine, and berries. Lignins are constituents of plant cell walls and found in many fiber-rich foods and fruits, such as wheat, barley, rice, linseed, cherries, apples, pears, and garlic. Cumestins are phenolic phytoestrogens, like cumoestrol, being a major constituent of this group. The cumestins are known for a variety of biological activities, and they can be found in alfalfa, clover, and bean sprouts. The consumption of plants such as soy, red clover, African plum tree, pumpkin seed, and Sarpameta for health benefits, particularly in ameliorating symptoms of benign prostatic hyperplasia, is well documented. Several experimental animal studies have shown the benefits of phytoestrogens in treating the benign prostatic hyperplasia. For example, an ethanol extract of echinops was shown to confer considerable improvements on the prostatic histoarchitecture of the testosterone-induced prostatic hyperplasia in rats. Also, a water extract of bitter leaf has been shown to ameliorate testosterone-induced benign prostatic hyperplasia in an experimental animal model. Red maca, which is a cruciferous plant from the highlands of Peru, was likewise shown to have reduced the ventral prostate size in normal and in testosterone-treated rats. The possible mechanisms of action of phytoestrogens may be related to their structural similarity to estrogens and their ability to act as a weak agonist or antagonist of estrogen. They could also act as anti-androgens by competing for the androgen receptors and by regulating the activity of the 17-hydroxysteroid dehydrogenase, which is an enzyme that's involved in the metabolism of testosterone. Clinical management of benign prostatic hyperplasia with Sarpameta is very popular, though Sarpameta extract has been shown to be beneficial in the treatment of LUTS that's associated with benign prostatic hyperplasia. The outcome of the clinical trials has not convincingly proved its efficacy when compared to the placebo, but perhaps this is due to the different formulations of Sarpameta extract being used in the study, and inherent flaws in the research design of some of the studies. Hence, it would be necessary to conduct vigorous research and clinical trials to prove the effectiveness or otherwise of a Sarpameta extract in the treatment of benign prostatic hyperplasia. Meanwhile, the current status of Sarpameta extract for the treatment of benign prostatic hyperplasia is safe and also could be effective, particularly in improving nocturia and other self-reported symptoms. A typical prescription would involve Sarpameta berries in a semi-fresh tincture made at a ratio of 1:3 and taken 20 to 30 drops every 3 to 4 hours for prostatic enlargement and for the irritation and the difficulty in urination. Black mulberry extract has a protective effect against experimentally induced benign prostatic hyperplasia in rats with regard to histopathological and biochemical parameters, which may be related to its antioxidant as well as its dihydrotestosterone-reducing properties in the prostatic tissue. Alfalfa leaf is typically taken as 1 teaspoon of herb with 8 ounces of hot water steeped into a tea for 45 minutes, and this being taken then at 4 ounces twice per day to relieve the prostatic irritation. Black willow is typically made into a fresh tincture in the ratio of 1:2, and the dose then being 10 to 20 drops every 3 hours for acute inflammation of the prostate with pain accompanying erection or ejaculation. Corn silk is made into a fresh tincture at a ratio of 1:2, and then this is dosed, typically 20 to 40 drops, repeated frequently for prostatic irritation with inflammation of the vas deferens or the spermatic cord, and a burning sensation when urinating. Gravel root is typically made into a tincture at a ratio of 1:5, and then dosed at 10 to 15 drops in water every 2 hours for an enlarged prostate with feelings of heat, difficulty urinating, cloudy urine, or urine that contains mucus. One of the most common complaints of men who sleep poorly is that they have an urge or need to use the restroom many times during the night. This can lead to sleep fragmentation and excessive daytime sleepiness. Most often the cause is an enlarged prostate. You should check out my video on herbs to help you sleep for more information on ways that might help here. One example is how melatonin supplementation helped benign prostatic hyperplasia patients with nocturia by reducing the habitual midnight awakenings. Stress can worsen the symptoms of benign prostatic hyperplasia or an enlarged prostate. Check out my videos on herbs for stress, on nervines, on various mental health conditions, on the different neurotransmitters, on the MTHFR polymorphism and its link to stress hormone to help to address any root cause or to help improve any imbalances in your body. Also research the pregnenolone steal to see how that stress can raise inflammation through increased cortisol, while at the same time interfering with your body's natural production of testosterone, estrogen, and DHEA.